Dear audience, welcome to the show POWERchat. This is the 138th episode of POWERchat. We have been presenting you with expert insights on development and diplomacy since 2016. We are live from TV Today studio in Kathmandu, and you are also watching us on Facebook page of the channel. At the time when the country is struggling hard combating COVID-19, the global pandemic, it has badly affected the healthcare system in Nepal, posing threats to patients of chronic diseases. Through this special episode tonight, we are discussing on COVID-19 impact on healthcare with particular focus on ways preventing community transmission and precautions for chronic disease patients. To discuss these issues, we have with us tonight Dr. Murti Anil, Cardiologist, Dr. Jyoti Bhattarai, Endocrinologist, and Dr. Sher Bahadur Pun, Virologist. Let us welcome them. Welcome to the show, Dr. Murti, Dr. Sher Bahadur Pun, and Dr. Jyoti Bhattarai.
Thank you so much.
You are welcome, and I'm starting with a very general overview of the situation at the moment. Today is the 83rd day of the lockdown, with some ease around shops and vehicular movements. As of today, there are 19 deaths, 5,760 plus infections, more than 143,000 in quarantines, and today only there are new infections recorded, that of 425. This is the highest in row today. I'm starting from Dr. Sher Bahadur Pun. How do you observe this overall situation, Dr. Pun?
Thank you so much again for inviting me. I think we are all observing the situation, what is happening in Nepal, the COVID-19, actually termed as a SARS-CoV-2, the virus. And since we first detected SARS-CoV-2 virus, that means COVID-19, then after that we have almost 2 months we didn't found any cases at that time, and then after that we subsequently begin to detect the cases that we are now at this moment. Now we have, as you said, 5,760, but during the first 2 months we didn't have any cases. And then after that, when we lose the lockdown, I think 2 days at that time, some weeks ago, then the cases begin to emerge, and especially from there where the people are coming from, the India, the border between the Nepal and India, and the migrant worker, let's say they are our brother and sister, they are entering from the India, and as we all know that at that time the cases have been rising at that time, and then those people who actually did not screen at the time, after they entered the Nepal, we found that they were infected with COVID-19 infection. And
Dr. Pun, are you trying to say that the situation now is not so improved with all efforts putting in and around lockdown?
Yeah, because there are so many, lacking. I mean, we actually did not follow the actual rule of the lockdown as we expected, because the aim of the lockdown is actually to maintain the distance between the individuals, and but as we know that we didn't see like that, and many people actually walking around, especially in the morning and the evening time. And if we look at to the media as well, and we can see that a lot of people are actually walking around, especially in the Tarai region, where the lockdown we did not found strictly following. So that is the main case why we are witnessing the cases actually rising up.
Dr. Pun, who are responsible for not effectively implementing the lockdown, public or the authorities?
I think First, I think public, because this is actually the government actually requested us, but at that time, probably we actually didn't take it as seriously. And now we all know that the people, if you go outside on the street, and then you can find many people are walking around and actually not maintaining any distance between them as well. And I think that is the main reason why we are actually witnessing a lot of cases at this moment.
Well, thank you, Dr. Pun. I will come back to you. I'm going to Dr. Jyoti Bhattarai. How are you observing the situation?
I think people are very nervous, and with the loosening of the lockdown and opening of everything, there's possibly going to be increase. And especially for my diabetes patients, they are anxious, and just being anxious doesn't help. As Dr. Pun said, it's not completely the government's job to enforce the lockdown. It's our duty also. So today also I was seeing so many people wanting to, even if they're talking to me, they want to come close to me. The physical distance is really important. Wearing the mask is important, because now the WHO has already said that washing hands is important. And don't bring not bringing your hand near your face, in your eyes and nose. Those are really important things. But if we, there are so many countries which have shown that if you do those measures, even if the lockdown is open, you are going to prevent the diseases. So we need massive, campaigning from journalists like you, and all of us should. Even though the lockdown is loose, doesn't mean that we go out and party and we intermingle with people. We need to have that physical distance, and I think if we follow that, we can reduce the spread of the disease as well.
Well, Dr. Jyoti, you have some audio problem, but so far I have got you. You are trying to say that the campaign should be massive. What should be done? Are you not satisfied with the current campaigns against, or the initiatives against COVID-19, combating it? What particular things that needs to be done at the moment?
You cannot be satisfied. Health is really a complex problem, and COVID is, COVID-19 disease, we don't know a lot about it. The whole world is struggling. The whole world is not satisfied. A developed country like USA is not satisfied. How can we, with our poor health infrastructure, be satisfied? We are not satisfied. But because we don't have a strong healthcare system to take care of really large number of sick patients, it makes economic sense to prevent the spread of the disease.
Well,
that
thank
is
you,
why it's
Jyoti.
really important.
I will come back to you on these specific interventions needed. I'm going to Dr. Murti Anil. How are you observing the situation? With lockdown loosened, and there are some vehicular movements, some offices are open, private car vehicular movement in Kathmandu Valley and around the cities. But we have seen in the recent days in neighboring India, Delhi and around the surrounding cities, along with easing of the lockdown, there was a rapid increase in the cases. How do you observe this situation, Dr. Om?
My view will be slightly different from what Dr. Sher has told earlier. See, the COVID affects the densely populated cities first. And so far in Nepal, the most densely populated, the Kathmandu Valley, is almost spared of coronavirus. Only few sporadic cases has been reported. And the most of the cases which we have seen so far, and the number of cases in Nepal is rising, is because of people have come from India, affected parts of India, especially Gujarat and Maharashtra. And because of that, the number of cases has increased tremendously in the recent few weeks. But in the Kathmandu, you see, I feel that lockdown was more properly instituted in Kathmandu, and that is the reason the valley is still not facing the serious problem of COVID, which we have seen across the globe. Now the problem, real challenge of the people of Nepal has started now, because we have seen when the number of cases were increasing in Delhi, number of mortalities were increasing, and they eased the lockdown. And they told, the Chief Minister of Delhi told that they are ready with the number, all the equipments, hospital beds, ICU, ventilators, testing capacity. They have all the facility to deal with the sudden rise in the cases. And now, after 1 month of easing lockdown, the number of cases were 500, now it is 2000 plus, and they are now in panic situation. The main thing is the number of cases starts rising after 4 weeks or 5 weeks of easing the lockdown. So in Kathmandu, another 3-4 weeks we are not seeing the sudden rise in the cases. And what will happen, that general public will think that no, even after easing the lockdown, number of cases has not increased, so let's go in the second phase. And slowly, this is the human nature, that we will keep on thinking that no, see, after going out, nothing is happening, we are not acquiring disease, number of cases are not increasing, and that will bring a wrong concept in the mind of general people.
Dr. Om, you basically said two important things, that people coming from India, especially that of Gujarat and other bordering areas, and because of that there was problem, and along with the easing or loosening of lockdown, it is not the appropriate solution. So you think that loosening lockdown is not an appropriate solution. What are your suggestions to the government? How can the government and other stakeholders combat this pandemic in Nepal?
No, the area where the number of cases are not high, like in Kathmandu, Bhaili, and major cities of Nepal, except few places, easing lockdown is not a problem. It has to be done, and it was the need of the situation also. We had to loosen. But the main thing is now how we are dealing with the situation now onward. That is most important. And this is the time frame, another 1 month. If government is vigilant and public are following strict things, what we have discussed earlier, if we are doing that, loosening lockdown will not affect us.
What are the key lapses, Dr. Om, and how can they be addressed with easing of the lockdown? What are the key lapses, key problems associated with easing of the lockdown, and how can they be addressed?
The number one is government has to be vigilant that after 4 to 6 weeks, they should decide the next plan. If the number of cases are not increasing, they should decide the next plan. And the most important thing, people from of country, especially the affected area, should not go across the districts. If it happens, that can bring a disaster, because we have already taken a big gamble by easing lockdown when the number of cases are increasing in country. The only one solution is if you have isolated different, particularly densely populated cities, and then you are ready with if the number increases, you are ready with the infrastructure, you are ready with the tests, if government is ready, and then the citizen and public are completely aware, they have to be careful for another 2 months, 1.5 and 2 months before you feel that we are protected. If these two things goes together, then we should not be worrying much about the COVID.
Well, thank you, Dr. Om. Dr. Pun, you have been working with this system, supporting the initiatives as an expert virologist from day one. How do you observe the safety measures that have been taken for the frontliners, medical professionals, healthcare professionals, doctors and nurses here in Nepal? Are you satisfied with the efforts? What should be done? There were huge outcry at the beginning. Even a minimum, equipments, PPE and all were not provided to the doctors and medical professionals. What is the situation now, and how can that be ensured?
Actually, as long as my hospital is concerned, I can say that we are at least up to date is okay, because I think we are getting the help from other institutions or NGOs like that, as well as the government, because the hospital is actually itself is a central government hospital. So I think up to date, I'm saying up to date, but I don't know next week, next couple of weeks, couple of months, we don't know about that. But right now it's okay. But as long as the other places, I'm not actually much aware about that. But I've read a lot of article or newspaper where they're actually concerning about the PPE, protective personal equipments, and I think this should also provide these things to prevent from the infection, because I have observed, I mean, the way of the infection actually showing the clinical outcomes is much different from other countries. That means the asymptomatic COVID-19 actually very interesting, because once I talked with the head of the epidemiology division, you know, the EDCD, and he was talking that actually Nepal witnessed nearly 90% of the infected person were asymptomatic. So this is actually very interesting for me, although I don't know the reason, and there are so many reasons to explain, because right now we only knew about this COVID-19 nearly only 3 months. So whatever the expertise is talking actually with a very limited knowledge. I said very limited knowledge. We don't know. Everybody say how long it will go. We don't know. Whether we have to live with them. We don't know. Whether actually the infection will actually completely finish for all time. I mean, like SARS-CoV-1 or SARS coronavirus, because I've witnessed 2003 actually, when I was working as a medical officer there, and then we also observed some suspected cases as well. So we don't know. So whatever we are talking, it's all are based on the article that's coming up every day. Even before I was talking, I was reading some article published in the Lancet, the medical Lancet, as well as other. So we don't know. We don't know everything, and we are talking based on either assumption or comparing the other virus, or probably their own, I mean, thoughts. So we are just learning and learning and learning. Everything is learning, because many researchers, I mean, right in the West country like USA, they said actually COVID-19 is the non-communicable disease as well. You know, so many stroke and so many vascular disease as well. They are showing and they are reporting. They are publishing all these things. So it's not all about only pneumonia, what we actually previously thought, and there are so many other symptoms as well as adding, such as loss of taste or loss of smell, something like that, as well as other things also. So as long as we are concerning about the hospital side that are we actually really ready or not, I don't think if I don't know whether the situation will go worse or not. That's also we don't know, because many people are fear, you know, inside the fear, and they all said, whenever I talk, that you don't have to so much fear and you have to optimistic, because if tomorrow it will come, we have to fight. So why we have to talk about like weak? But at the same time, I always saying that we have to prepare all the time. We have to improve our weaknesses, you know. So that's all we have to need to do. But the thing is that if somebody will ask, are we ready? I said, is US is ready? Is Italy was ready, or Europe? I don't know, because they're all facing the same things. And the interesting thing is that everybody think that there is a huge problem in Nepal as well. But why don't you look at the Taiwan, the Kerala inside the India, the Kerala model we said, as well as the Japan or Vietnam, where even no death is recorded.
Well,
so
Dr. Pun, very interesting, but you told us with a very serious note as well. Are you indicating that our efforts are struggling high, and they have a very ready-made answer to the question we don't know? How long it will take to control this pandemic along with these all initiatives? At time you are observing that we don't know a lot of things and we are doing experiments.
Actually everybody's experience, you know. If you ask any, I was reading that even the estimated of death rate also discussing each other. The one pointed out, the another researcher, maybe that is wrong, that is right. And actually, that we are looking them, but at the same time, I think we can do a lot of things that experience our own, our own experience. We have to make and think and everything, like if we talk about the lockdown, I think we can make our own model as well, because we are not China and we are not India. Both has a different the trend we can see, but at this moment, I can say that we have to fight and we have to learn a lot of things. We have to continue read and learn from the other country as well. But the thing is that if you think about the USA, probably we cannot compare with that country as well, as long as we can. So, but
Well,
from
thank
our
you,
side, we
Dr.
have to
Pun.
do a lot
I'll come back
based
to
on
you
our
with
resources, based on our
more questions. I'm going back to Dr. Om Murti Anil. What do you have to say about the impact of this pandemic into the lives of people suffering with the chronic diseases, that of your own area, heart disease and cardiology and all, and how the medical service providers are prepared to serve the most affected, that of the chronic diseases?
See, this is because of COVID, those chronic medical conditions like hypertension, diabetes, and heart disease and kidney disease, these patients needs regular follow-up. And if they miss regular follow-up, many times simple problems, if not picked up during follow-up, if a patient is not coming for follow-up for some reason, then there is a possibility that it may turn into emergency and critical condition, and people can have sudden death and they can die before going hospital emergency also. Most of the heart cases and hypertension and some other chronic illnesses. So what we have seen, because of different reasons, because of transportation, because of facilities, leisure facilities, and the biggest fear is catching up coronavirus by going to public places like a hospital. People are not getting treatment and regular follow-up in time for last 3 months almost. And this is the biggest problem. I think that now people will start developing serious issues and sudden medical emergencies will start increasing in coming days if the treatment of these chronic medical elements are not properly organized. Still, if you ask me, my parents are not going to take to any hospital in this condition where you will think that there is a possibility of catching infection from the other people. So we have to have a clear plan that where to manage COVID related patients and where to manage general patients. Still we are confused because our infrastructures are not like Europe, that you have separate rooms, separate emergency entry. You cannot manage. You have same emergency room where you keep all kind of cases. So it's a very difficult situation. So in this condition, what I think the best solution is to make separation between COVID and non-COVID. Even if you don't have plenty of cases, government can easily allot one of their government hospital that this is COVID and this is non-COVID. So people have at least satisfaction. They have confidence of going and seeking the treatment. But at this moment, it appears very difficult. What Dr. Jyoti also mentioned, that people are coming very close to medical doctors and health workers, and they feel that they will health workers are more vulnerable and they can transmit disease to the patients. That we have to understood.
Dr. Om, do you have any specific data at the moment that, as you said, non-COVID patients are not accessing to their treatment because of the fear of COVID-19? Is there any fallout accessing patients to your services because of the fear?
Yeah. See, because now, in my knowledge, I have talked with the different small clinic, hospitals. Only 15 to 20% of capacity people are coming. So where the 80% are going? They are staying at home. They are not aware of their conditions. They are not knowing whether something is wrong, some blood parameters are wrong. So this is the real problem. We cannot say exactly how much, but significant number are not going to hospitals. And there are reasons, we can understand there are reasons why they don't want to go to hospitals at this moment.
Well, I'm going back to Dr. Jyoti Bhattarai. How are you observing this situation, especially that of what Dr. Om said, non-COVID patients, maybe diabetic patients and all?
You know, the diabetes is complex, COVID is complex. It is really, really challenging. On one hand, you need the regular follow-up. On the other hand, if you have a crowd, you have the potential to increase the COVID risk. So you try your best to use the PPE and cleanliness and all that, whatever the health services are providing, they are trying their best. But you have to remember that we are resource poor and we don't have a consolidated, really good COVID plan also. As he said, you know, if it's going to spread in 1 month's time, what is our plan now? So this is the time to assign separate hospital for COVID patients and other hospitals so that they don't intermingle. And also the testing is a problem. The PCR is bottlenecked. We may not see more cases because we don't have the facilities. So the government should be open to the private institutes also doing the PCR test, because if you do the test, then you can isolate that particular patients. And to address the chronic care management issue, we have been making use of telehealth also. Some of the patients' blood pressure, sugar can be adjusted if they have a blood pressure machine, or some nurse at the home, you know, your daughter-in-law or something. So we can do, you know, address some of the challenges. But already our, health infrastructure is so much thin. You know, it's already so stretched. It was not, without the COVID, it was challenging to address all the chronic care problems. And on top of that, you add the COVID. Yes, we have to address the chronic illnesses, especially cardiology and diabetes and things, but at the same time, because the COVID is imminent threat right now for our lives, I think the government should be more proactive in forming high-level scientific body, you know, the doctors' body who have the power to make decisions and do things, you know, people like Dr. Pun, and they are there, but, you know, a lot of the experts tell us that there are lots of meetings and things, but nothing concrete comes out. For example, there is bottleneck of the PCR. It shouldn't happen. And for example, we are always using that term, okay, they are coming from India. They are our people. They bring the remittance, and because of them, our country was viable, because they contributed so much to our economy. They are our brothers and sisters. They are in vulnerable position. We dump them in the, you know, quarantine, and we don't even assign one doctor and nurse for them. We are lacking compassion, you know. So I think our brothers and sisters, we should be focusing on them also. They should, if we can't provide them dignified quarantine, let them go home and give them proper instruction to stay in isolation, you know.
So, Dr. Jyoti, are you trying to say that our quarantines at the moment are not up to the standards? And
some of them, yes, some of them, not all of them. You know, whichever places have good standard, we should really admire them and admire the work done by local governments. But we are a country of one man. So I blame the journalists and I blame us also. We have not demanded to ask for a improvement of our system, health system. We are already at the bottom of our, compared to other countries, even, among the South Asian countries, Sri Lanka is good. We are probably compared to India, Pakistan and Bangladesh. I mean, we are so poor as a foundation, and we always look up to one.
Thank you, Dr. Jyoti. I am carrying forward this response to Dr. Pun. Dr. Pun, there are worst cases of quarantine management here in Nepal. There are many media reports that people kept in quarantine or even isolation wards have not been appropriately treated and they are not up to the standards. And there is a media report this afternoon, this evening only, from the far western quarantine that one of the women has been raped in quarantine. there are many safety issues around, the quarantine facilities are not up to the standards. Now the safety of people residing within quarantine, how do you see this situation? Our initiatives are failed providing safety and taking care in mind the gender sensitivity within quarantines across Nepal?
Agree with you that probably the quarantine, actually we are, the media is showing that the quarantine in the different places actually not up to standard. As we all actually watching a television and reading a newspaper, we can see that the quarantine, many quarantine, I can't say all, but many quarantine, the sites are actually not according to the guidelines. So that is the main problem. And the main problem is that if that is not according to the guidelines, that means the infection between the two individuals is highly likely. So that is the main reason, and that is my personal, maybe the others' concern as well, because infection can be transmitted between two persons if one is healthy and one is infected. Because I already said that the infected person actually in Nepal is it looks like they are asymptomatic, I can say, and without illness. They are showing we don't know that whether these people actually infected with the coronavirus or not. So that is the main problem. So the quarantine must be up to the standard that the guidelines is actually showing. So that is problem. I can say problem.
Dr. Pun, do you think that one can be considered corona free after completing 14 days time at the isolation center? What are the chances of transmission at family and community when one goes to home without testing?
Yeah,
but spending time in the isolation?
Yeah, this is the debate issue right now, and I can say that the person staying at the quarantine, and after 14 days, if he or she goes to his or her house, I think that would be not problem. But the problem is here if for example, because our quarantine is packed up with many people, and if you look at the television, and they are actually sitting together and having dinner or food, something like that, and that is the more likely chances to have infection from the infected person. I mean, the healthy person can be infected with that the infectious person. But the problem is that if you don't test that at that time, for example, I can give you a 5%, so they are staying in the same room, and because as I told you that many of them are asymptomatic right now, many of them. So if the one person is infected and without showing any illness, and if he infected nearly the 10 days, the person who infected from that person can be counted from that days. That means 14 days means he is actually going home after 4 days. That means he can transmit the infection to his or her relatives, even his family as well. So that is the most concern from my side. So that is why, because of the asymptomatic problem and the infection, and without doing this, testing, can be somehow problematic in future. But if you look
Dr.
at the
Pun,
guidelines,
on quarantine, can we sum up that on quarantine issue? Can we sum up that the quarantine guidelines, that of the WHO standards or that of the testing strategy guidelines, are not appropriately followed here in Nepal? Can we sum up?
No. Yeah, I'm just telling that the guidelines that without testing, if we are sending them to a house, if everything is okay according to the quarantine guidelines, that is okay, because the latest research article actually reporting that after 8 days, or some papers say after 11 days, let's say 14 days is okay. After that, the virus may not be active. That means the virus may be not infectious. That means they can't transmit the virus as well. But as long as I already gave an example that if they are together and they are sitting, they are having the food and everything, then the one who actually infected but without showing any symptoms can infect at any time, and from that time that the infection, the period will count. So that is the main problem.
Well, Dr. Om, how are you observing the awareness level of Nepalese people in an effort to fighting COVID-19? You know, there are rumors that Nepalese have a low mortality rate, and it may not attack or it may not easily, infect with these people, and Nepalese also have a stronger immunity power. Is that true?
See, what in recent time we have learned to make early conclusions. With very limited knowledge, we end up with making conclusion on everything. And we thought that only 19 cases have died among more than 5,000 cases. So the ratio is less than 1% case fatality rate, and we compare to other countries, and then we say that mortality in Nepal is very low, probably immunity, we have a stronger immunity. But we forget to see the data that 99% of affected individuals are less than 60 years. And 20 to 40 year age group, there are 60% of total COVID infected patients. So the population with the best immunity will definitely have lesser complications, lesser mortality, lesser symptoms, lesser ICU admissions. And if we compare the same age group mortality to other countries, at some point we are having more mortality. So then now we are talking about the immunity, then we talk about so many other things, but it is very superficial knowledge and superficial conclusion. We don't have a different genetic than the neighboring country. We see that in Mumbai, how the people are dying in other parts. So it will be too early to make any such conclusion. And the most important public health concern, which very senior people, responsible people are not trying to understand, that the implication of telling that Nepalese are immune to certain disease, we have asymptomatic cases more, it making people not to follow strictly the precautions measures. This is a major concern. If you are telling you are immune, people will go and they don't follow anything. If you are telling, no, we are not immune, we have to take precautions, then everybody will follow that. So this is because our health literacy education is less. So people who are in the leading positions, health workers, media people and everybody, we have to tell people the exact situation. Now to begin with, people were very strict on the social distancing. They followed in Kathmandu, we can see they were following seriously. But now people have got tired of listening all this stuff and they don't believe you. They are occupied with some other ideas and they are just claiming that no, what we are talking is just nonsense. They are not following.
Well, thank you, Dr. Om. Thank you for your insights. You basically said that COVID-19 has nothing to do with the origin of people or nationality of the people. All you need to do is to take care of the standards set up by the authorities, including that of the WHO. I'm going back to Dr. Jyoti. What are the specific complications that the diabetic patients are facing at the moment, and how do you plan as a medical professional or the public and private sector medical service providers should prepare themselves to ease this problem, having appropriate treatment at the moment? What are your suggestions, Dr. Jyoti?
First, I want to reduce the people's fear that COVID will attack diabetes people more. It's not true. If you take the precautions, diabetes people will be protected like somebody else. So that you have to understand. The infection will happen only with the exposure. Without exposure, the infection will not happen in diabetes person. But if you have diabetes, you are more at risk of becoming sicker. For example, in the ICU, really severe cases, studies have shown that up to 16% patients were people with diabetes. And if you have uncontrolled diabetes, you are at more risk of having complications. Your mortality or chance of dying if you have diabetes and COVID is more, 3 times more than somebody else. So you should not panic, but take the strict precautions, the physical distancing, the washing the hands, wearing the mask, those are really important, and keeping your sugars under check. And you might run out of the medication, but don't worry, go to the nearest shop, and even if the company is different, you can buy, whatever medicine is available, stock up on your medicine, eat your planned meals, do your exercise, and mental health is a big one. People are worrying so much, the worry itself is increasing the blood sugars. So try to reduce the stress and get help. There's so much suicide, you are hearing that. So mental health and chronic illnesses, they are all joined together. So people are trying to address that, and we want people to get together with the family and play some games and do some meditation. So try to allay the stress, and also monitor your blood sugars. As a physician, I'm seeing my patients in the clinic. I encourage them to not to come to the clinic unnecessarily. But there are people like who are pregnant with diabetes, who are old people who have urine infection with diabetes. They come and we try our best possibility. We keep the distancing and clean the doorknobs and things, and wear the protective shield and mask, and try to give the best, safest possible in a private setting. But in the government setting, I think there are still challenges, because some of the places even complain that because of our bureaucratic and logistics problems, some of the places don't even have sanitizers. So we have a big logistics. I mean, there are beautiful reports and beautiful things in the government thing, and we have to understand that it cannot happen by a health minister or prime minister. It is a collective effort. So we should be looking at that and trying to, in each individual, whether it is private or public, we should try to maintain the safety measure. The other day I went to one of my friends had some heartburn, and he thought it was a simple heartburn, but as Dr. Om said, he could have, MI. So he went to the Gangalal hospital. Thank God, even if it's a public health care system, it's running well. There are 35 beds in the emergency. They were taking care of him. Promptly, he got the angioplasty and he was discharged out of the hospital. So, Gangalal is one example of, they were maintaining the social distancing, trying to, wear the mask and things. So even in the government hospital, if you have the, the managerial skills, you can do that. So
well, Dr. Jyoti, any specific measures that you see should be taken out for the elderly people, the pregnant women, and that of the girls and those not having access to your treatment at the private sector? Any specific measures so far as the safety of patient is concerned?
If they have uncontrolled blood sugar, they definitely need to come see the doctor. If it is for the first time, they need to learn about the diet. They need to learn about checking their blood sugars. If it is absolutely not possible to come to the doctor, we can do on the phone. We have been doing on the phone also. It's really important to keep the blood sugar in the good range by checking the blood sugars with the glucometers, by eating planned meal, balanced diet, by taking the pills that are recommended, and trying to keep your stress down, and communicating with your doctor. Those are the things that are important.
What could be the role of government authorities accessing treatment and health services, because many patients throughout these lockdowns faced problem of access to the health services?
Okay, I gave you one example of Gangalal, which is a government which is not still completely free teaching.
But Gangalal could not reach out to all parts of the country as such.
Yes. But in paper, in policy, government has since 2017 something called Pant package for non-communicable disease. It's beautifully written, and not only during COVID, after COVID also we should focus our attention on preventing the non-communicable disease like greenery, and all these things are there in the policy. But we don't have that. What is the cost? What is the logistics? We don't have. Our system is in doldrums. In the policy and paper, it's really beautiful. So the Pant package for the non-communicable disease in the government service is launched in more than 30 districts. The plan is to, incorporate in all 77 districts. And we talk about that, but when it comes to the doctor who's giving the service in the front line, he is all bottlenecked. He has to take care of TB, he has to take care of OBGYN, he has to take care of diabetes, hypertension, all sorts of things. So we need the manpower, we need the system change, we need really revamping. I think COVID has given us the opportunity, and it's good thing is that the budget, more health money is allocated, but not specifically to the non-communicable disease.
Well, thank you, Dr. Jyoti. Dr. Sher Bahadur Pun, do you agree to Dr. Jyoti's statement that our system is in doldrums? It's not working appropriately, and it suits appropriate in some cases. There is public criticism, and there are many media reports that the rapid diagnostic test is not so effective. The inefficiency within this test, along with the more negative false cases. How do you see this? Why government entities or government authorities are not able to, provide with the appropriate service that of the PCR across all centers or all provinces?
I agree with Dr. Jyoti Bhattarai, because the health system is not actually well established, and there's so many lot of problem, as we already have now seen already, because many people even don't know where to go and with whom they have to talk about these things. As long as the testing problem, yes, we have been saying a long time ago that the testing, we have to the number of testing we have to increase, and because that give us somehow like estimation. Like, for example, if we increase our testing, then we can estimate that the number of the worker, I mean the medical doctor or health worker or infrastructure, what kind of infrastructure we have to establish, such a things. And even in the policy level, it's very important. And at the same time, actually, talking about the PCR, of course, there are a lot of, the lack of testing on the PCR. And we actually, the people are every time talking about the PCR right now. Even today, I have seen almost 1,000 people. Actually, they are not the patient, actually not with the symptoms. They are visiting to our hospital, but they have panic. Maybe they went out of Valley, or they went for outside, the shops, and frequently, and the house owner or the neighbor or even the local government who actually we say what are the chairs, they also send that kind of request that do the PCR and only come and enter your house. So these are all the things that probably we are actually misusing as well. From my side, I can see that, because almost more than 80 or 90% we all give them a counseling, because you don't need this thing and that thing, but they are insisting, because without that certificate they can't go back to their home. So there's a misusing as well, because these PCR testing probably, if we provide to those who are actually coming from the India, I mean, because as we know that they're lacking testing, and they're even waiting for a long time, because we already heard about news that many people are actually even past the quarantine period, but they don't have actually report on their hands, so they can't go to their homes, and without that testing, even they are not accepted in their hometown. So these are the problem. Of course, there is a lacking, we have to increase the testing, and so that we can even convince them, because there's the problem with the psychology as well. If I don't have testing, that means I may have a infection, or they are not accepted by their
Dr. Pun,
family.
There are many interesting issues around, but we are coming to the end of the show. But before we wrap up, I'm going back to Dr. Om. If you have specific insights to share, especially that of the complications associated with heart disease during COVID-19? And what are your suggestions to the patients and healthcare service providers overcoming these problems very quickly?
Number one, for public perspective, we have to be careful for another 3 months. So all the high risk population, those who are more than 60 years and suffering from heart disease, chronic kidney disease and some diabetes, they have to take extra precautions and they have to avoid the public places as much possible and adopt all the measures which we advocate and which we know when we are going out. From government perspective, what I think that prediction and planning is two important things. We have to predict what will happen in, suppose you take what will happen in Kathmandu after 1.5 months, and we have to learn from other places, and we have to predict that number of cases will be such and what will be the need. So what is happening, we are planning something after COVID has done the damage. We have to think before and we have to plan before about the number of tests. Now you need 15,000 tests, 10,000 tests per day, and now you are planning to purchase machines, purchase kit and training the people. No, this is not going to solve the problem. You have to predict and plan well ahead of impact. Then only we can fight and we can prevent the most of the deadliest complications associated with COVID. What we have seen, the mistakes done by other countries, other cities, we don't need to repeat the same thing. We have to plan much ahead before Corona strikes.
Well, Dr. Om, any specific suggestions to the government addressing COVID-19? Very specific and very quickly.
We have to be very particular about the easing, and if we are easing the lockdown, then we have to be ready with like how the people from other parts of the country going across the districts and people from other countries when they are coming, particularly from the infected countries, we should have a very clear plan on this, and then only we have to plan that how we are taking further steps.
Dr. Jyoti, your final thoughts, any suggestions to the authorities overcoming these challenges around?
One testing, PCR testing increase. Number 2, clearly designate the COVID hospital where patients can do. Number 3, treat our migrants who are coming back with dignity. They are human beings, they are brothers and sisters. They don't, one of them died because he couldn't even get fluid because of diarrhea. So whenever there is quarantine, there should be a doctor and nurse to take care of them. So those are the 3 suggestions.
Dr. Pun, any specific suggestions to address the challenges and overcome this problem very quickly?
I can say 3 things to be kept in mind. That is hand washing, making a physical distancing, and the masks. Whenever you go to the public place or where there is so many people walking around there, you have to wear a mask. So these are the things we must now remember every time, because as we are now on the another phase, that is easing the lockdown, so many people probably coming out. So that means the physical distance may not maintain. So people actually may not care about that, but that is the main important thing. Because very recently the researcher from the London School of Tropical Medicine and Hygiene, they estimated that previously they estimated that from 1% probably nearly 3% can infect from the 1%. Right now I think that is somehow 1:1 or even maybe decline, so less than 1. So that is how they think that because of the lockdown, but that means that that is the maintaining the physical distance between, or they are not close each other. So this is how we have to learn. And even today I was reading the article that's saying that if you wear the masks, then the rate of transmission of COVID-19 is drastically reduced. That means That is also important point that I want to
Dr.
share.
Pun, thank you very much for your insights. I would like to thank each one of you, Dr. Murti Anil, Cardiologist, Dr. Jyoti Bhattarai, Endocrinologist, and Dr. Sher Bahadur Pun, Virologist, for being with us tonight and sharing with us very important insights in fight against COVID-19 here in Nepal. Thank you so much. Dear audience, time now to wrap up this show. Keep watching us. See you next week. Namaste.